Myers, and today I will be talking about how some back surgeries are successful and how some are not. Each year, millions of Americans experience acute, recurrent, or chronic pain, and for many of them, surgical interventions fail to reduce their suffering. On the other hand, there are many patients to whom surgery transforms their physical dysfunction, discomfort, and dependency into productivity, ease of movement, and emotional stability. Fortunately, there is an ample evidence that shows key factors which affect the experience of and adaptation to pain. We will examine the elusive nature of pain relief to better understand when a surgical intervention has the best chance of providing pain relief. One of the most common causes of pain happens when one of the discs in the spine is bulging or herniated. The discs in the spine normally act like soft cushions staying between the bone segments of the spine called vertebrae. But when damage occurs in the disc, likely from lifting too much weight or a car accident or excessive pressure over time, the result can be very painful. The damaged disc will flatten between the vertebrae and bulge out to the side, touching the nerve which runs the length of the spine down one's toes. So if you look over here, this is an actual image of my father's herniated disc, and as you can see right here, there's a bulge coming out from the spine, and that's what's making this nerve right here pinch, and that's what's causing the pain. So this disc would have to be removed in surgery. So as you can see, that's really, really, really painful. Fortunately, there are surgical solutions to address spinal issues, such as disc herniation. One of the most common surgeries, and the one my father underwent, is called discectomy. As stated by Hoffman in colleges, discectomy involves removing a small amount of the disc which has been damaged. By doing so, the surgeon removes the pressure of nerve caused by a herniated disc. In some cases, the surgeon will choose completely to remove the damaged disc altogether and fuse the adjacent vertebra together. The procedure is called a spinal fusion. According to a comprehensive review of 71 cases by Agzi and colleagues, fusion surgery successfully fused the two vertebrae together in vast majority of patients. Over the years, many studies have been dedicated to exploring why some patients fare better than others after surgery. The end result of this research points the importance of screening surgical candidates for certain risk factors which may attribute to post-surgical pain. Even though spine surgery can fix a damaged spine, it is no guarantee that the patient's corrected anatomy will also be pain-free. Whether it's a minimal reduction in pain, no change at all, or perhaps even increased pain, the spinal patient unfortunately cannot trust the properly performed surgery will ease the suffering. I will now start to explain what important factors, beyond medical ones, can determine whether or not surgery can significantly reduce or eliminate back pain. Okay, so behavioral historical influences. Part of the screening process is to look for key behavioral and historical issues which may affect a person's pain experience. The unfortunate legacy of abuse can also affect the outcome of spine surgery. Schofferman and colleagues conducted interviews of 100 consecutive lumbar spine patients and found that those who reported no childhood abuse had a 95% surgical success rate. The researchers defined success as no repeat surgery was needed, patient returned to work or regained previous functional capability, and didn't rely on pain medication. Those patients reporting multiple instances of childhood abuse had a success rate of 15%. Personality and emotional issues. Research shows that the screening process also needs to identify effect of personality, or emotional issues. Common problems with mood, such as anxiety, can pose a real barrier to surgical success. For example, according to comprehensive review by Keokult and colleagues, anxiety has the potential to interfere with recovery from spine surgery by influencing the surgical process itself. Post-retrospective healing and sensitivity to pain in both the immediate post-op period and for the main months of thereafter. Preparing for the patient for spine surgery. Once a patient has pre-screened and confirmed a good candidate, then the final step in ensuring a good outcome to physiologically prepares the patient for the surgery. The reasoning here is that the patient may hold a number of erroneous thoughts about the upcoming surgery. These thoughts, which arise out of fear, desperation, and uncertainty after many months of years of demoralizing, ineffective medical treatments, can be altered through cognitive behavioral techniques. Such an approach teaches patients to alter negative thoughts and learn to induce a relaxation response. A meta-analysis of 191 studies of Devine found that the relaxation response itself is associated with positive physiological results that can enhance wound healing and surgical outcome. In conclusion, I briefly informed you about the factors that have influenced the success of spine surgery. As you can see, there are a number of important factors to consider when deciding when or when not to have surgery, or when it could be successful to reduce a person's pain and limitations.